In this video, I'm going to be demonstrating how to do newborn screening procedures. So we can start with vitamin K, always confirming with the parents that they do want vitamin K injection for their child. Typically, we'll do this when the baby is calm and with their parent being held, so the pain is a little bit less for them. We generally use the box of phytonadione, 1 milligram, and without benzoic acid. It comes out of the box in 2 little pen-like things. One has the fluid and the needle, and the other has the plunger. So you take that out, pop caps off of both ends, and then kind of screw them together like so. Make sure that the baby's leg is exposed, and then once this is ready, I kind of set it down. I'm going to have a cotton swab that's ready afterward. I'm going to grab a prep pad and just cleanse the area really well. And then I'm going to grab the injection, and I'll let the parents know that I'm going to poke their baby so that they can talk to them. And then I'm just going to squeeze the site, making sure that I'm going to hit the muscle and puncture, and then I'm going to press in that fluid slowly. And then after the injection is done, I pull that out quickly, and then I rub the area gently to help with healing and less bruising. Generally, it doesn't bleed and doesn't require a Band-Aid. Most parents don't want a Band-Aid. Then I'm going to write down the lot and expiration number and chart when the injection was done. For erythromycin, again, confirming with the parents that this is something that they're wanting for their baby. While the baby's calm, once again, parents are generally holding their baby. I'm going to grab the ointment, uncap it, and then I'm going to pull down the baby's eyelid just a little bit, and then I'm going to squeeze just a thin stripe in that lower eyelid, and then I'm going to make sure that the eyelid opens and closes a couple times just so it's really getting in there. And then I'm going to repeat that on the other side, and then kind of open and close a couple times. After a minute, the excess can be wiped away. And then I'm going to chart the lot and expiration number and what time that was administered. Then for pulse oximetry of the baby, I'm going to remind the parents why we do this test and how it's going to be done. It's very quick. I'm going to grab this pulse oximeter. First, I'm going to do the baby's left hand, and I'm going to put a couple of fingers in here like so and wait for the reading. It should be over 95% past 24 hours. So once I get that reading, then I'm going to try the foot of the opposite side. So I'm going to do the baby's right foot, and there shouldn't be more than a 3% difference here. If there is a 3% difference or more, or if the baby's testing 95 sat or less, then we're going to repeat this test again in an hour. If it's still off, we're going to refer to a provider. So that's very straightforward. Then for the heel poke PKU screening, again, generally while the parent is nursing, I'm going to have the baby's foot exposed. When the parent is nursing, I like to use gravity as much as possible to get the baby to bleed. So I would use this foot that's down here. First, I'm going to cleanse the area and kind of look for that outer lower portion of the baby's heel. Right in here is kind of where I want, for means of saving this thing for another use. I'm just going to demonstrate how I do this. I would also have a cotton ball and Band-Aid that are ready, and then I've got my screening card right here. I fold this over and and I'm ready with my dots. So I'm going to tell the parents, I'm going to poke your baby. They're holding their baby. I'm going to grab the infant's foot like this and kind of like bend it. And then I'm going to line it up and poke there. And then I'm just going to kind of do like a little tourniquet type thing like this with my hand so that there's not too much pressure, but there's enough to draw the blood flow down. I'm going to wait for a big drop of blood to come, and then I'm going to place that drop on the card and keep going down the line until all 5 are filled. In Washington State, we actually don't have to have all 5 filled. As long as 3 are completely saturated, they will still process it, which is great. So after that's done, I'm going to put a little cotton ball on the baby's foot to stop the bleeding, and put a Band-Aid on if that's what the parents are wanting. Some parents don't like that. Some babies who don't want to bleed, we can use a warm compress too, but this baby didn't need that. Then all the information is going to be filled out on this card, and it's going to be sent in to the Department of Health same day. All right, that wraps it up.